I want to acknowledge that I'm calling in from Gadigal land today, of the Eora Nation. I want to pay my respects to the elders past, present and emerging, and also to any Aboriginal and or Torres Strait Islander people who are with us today. There's been quite a, I think, devastating loss within the Aboriginal and Torres Strait Islander community in Victoria around one of their home trees being destroyed recently. And I think it's important that we are aware of issues that are pertinent to the Aboriginal and Torres Strait Islander community. And one of the really easy ways to do that is to just follow active activists or advocates within the Aboriginal and Torres Strait Islander community, given that they are the oldest living continuing culture on the earth, and continue to pay our respects and understand their ways of learning, one of which is around conversations similar to what we're about to have today. So thank you again for coming along to our discussion for Intersex Awareness Day. You may be aware that Intersex Awareness Day was actually yesterday. We're having a discussion today, I think still acknowledging the power of that day and what it means to be able to have open discussions and bring awareness to a community that is attached to the LGBTIQ acronym. But I think often there is a lot of misunderstanding, misinterpretation, and subjugated knowledge experienced from within the community. So ideally, at the end of this session, you will have a better understanding of what it means to be an intersex person and some of those experiences that happen as part of being intersex or identifying as intersex. Joining me on the panel today, I'm really excited. We have our very own Morgan Carpenter from the University of Sydney, Dr. Agli Zavros-Orr and Gabriel Filpi, all joining us on the panel. And I think rather than maybe me doing the introductions, I thought it would be nice for each of them to individually introduce themselves and maybe let us know what traditional land they're zooming in from today, as we are all from different areas. And if you want to add to that conversation as well, feel free to add in the chat box what land you're calling in or zooming in from today. Morgan, perhaps we can start with you.
Hey, thank you very much, Jack. It's really great to be here with so many people today. So I'm really glad that you're all here. I am zooming in from Wiyabal land in Bundjalung country in northern New South Wales. Yeah.
And Agli?
Living and working on Wurundjeri land, and working as an independent academic, sort of supporting the educational sector to better understand issues impacted on people with an intersex variation, but also looking at issues relating to intersectionality, so across faith groups, ethnic groups, language groups, etc.
Thanks, Agli. And Gabriel?
Hi everyone, I'm calling in from Ngunnawal Ngambri country in Canberra. I work for two sort of community and peer organisations supporting intersex and transgender people, and more broadly doing the Safe Schools work in the ACT.
Thanks, Gabriel. So I guess first off, one of the key questions that many of the people coming along today, I think, have or interest is around what does it mean to be intersex and what does intersex itself mean? Morgan, you have had many discussions around this as a huge advocate and somebody who I think has made incredible movements for the intersex community. Can you give us an understanding or an explanation into what does it mean to be intersex?
Thank you. Okay, so intersex is an umbrella term. And it's an umbrella, it's one of several different possible terms that people could use. It's an umbrella term for people born with sex characteristics that don't fit medical or social norms for what it means to have a female body or a male body. So there can be some variation in chromosomes, other genetic factors, there can be anatomical differences or differences in people's hormonal response. There are at least 40 different intersex variations. They could also be called differences of sex development or the very controversial disorders of sex development. People will sometimes talk about variations of sex characteristics as well, or people will often use diagnostic language. And there are more than 40 different diagnostic terms that individuals might use. And I think we also share some issues in common across those different diagnostic groups. And those commonalities lie in experiences of stigma and discrimination because our bodies are perceived as different. So very typically there is a risk or an experience of medical practices aimed at making our bodies look more typically female than male.
Thanks, Morgan. And I think obviously you touched on it there. There is a number of variations in terms of intersex and sex characteristics. Agli, this is something that you have done a lot of education around and talk about, you know, those identities and how interventions can impact people's experiences. Can you give us a bit of an understanding of what that's like and what sort of things you do discuss?
Yeah, so following on from what Morgan has said, I think one of the key points, and we'll pick up on this later, is around subjugated knowledges that situate people in particular ways. So I think from my perspective, how the medical profession defines bodies and body norms is part of the issue. Of course, when you then talk to people with an intersex variation, they come from all different walks of life. They have different lived experiences. So each develop their own unique understandings of their own bodies and what it means to be intersex for them. But as Morgan said, we share a lot of things in common. And one of the part of what we're trying to do as a community is to develop shared language around talking about intersex. So it's not an easy term to get your head around. And because people come from different language backgrounds, and there's different language that has been used across time, across different language groups to talk about bodies and body identities. And so it's really important to make space to listen to what people bring to discussions of their own identity, but to also hold what Morgan has said, that we understand that intersex in and of itself is not an identity. It's about, you know, sex characteristics, and then how people understand sex characteristics.
You've been breaking up, Agli, which is a bit sad.
Agli, did you want to try maybe just turning your video off, and then we can see if that will allow you to just finish the point? I think you got to the back.
Oh, you didn't hear all of it.
We just missed the part after you were talking about intersex isn't an identity.
Oh, okay. So did you hear the rest of it, or did it break up?
Just the last piece, the last part.
Oh, okay. So intersex isn't an identity, but people sort of have to remember now. But people come to understand their bodies through their lived experiences. So I think it's really important to make space to hear those individual stories, but to also bring to those stories what the human rights movement is trying to do in terms of having a common language about what intersex means, you know, around sex characteristics, and then how we come to understand our sex characteristics and our body shapes, and how we live and build relationships and community.
And community is definitely a hugely important word there, Agli, that you've brought up, and something I think we've discussed kind of at length in terms of that importance of finding community and finding acceptance or almost family. Gabriel, with your work, have you had much experience in terms of working with younger people or working with people to work through understanding their own identities, or has this been a conversation that you've had in the past with other intersex people?
So I work in conjunction with Cody Smith, who is our Intersex project officer here in the ACT. We work for a peer organisation. So Cody's really the main person that's had a lot of engagement with people and a lot longer sort of history and grounding in the community here. We are seeing sort of parents engaging as well, particularly when there's like young children who are at a point where I think when we talk about identity, we have an assumption that someone's old enough to form an identity or to understand themselves in that way. And just in terms of services in intersex sort of group work and any of that, it's largely not funded, and there's a big gap, I guess, in terms of parents who, when we're talking about young children coming in, they're really at the forefront of that. So it's not sort of a point where you're coming into having an identity or forming an identity until you're much older, and you might come to it from a different point when you're older and engaging with peer networks. Yeah, I think it's a complex sort of thing when we talk about identity and coming to understand yourself in that way. There's also the whole practice of disclosure and that where parents, doctors, families might withhold information, and people will come to know that they're intersex throughout their life. So it's not sort of something that you come into an identity as such. You might have information and then later find community, particularly if you've had medical engagement and that sort of thing. You might have just been given a diagnostic term or something and then told off to go and research it and Google it on your own. So I think it complicates it in terms of we think about identity very much in the LGBT sort of umbrella, where you sort of find where you fit and where you feel, whereas it's almost like a reverse engineered sort of experience for a lot of intersex people, where they find the community and the identity later on in like a retrospective way.
Yeah, it's an interesting point, I think, and something that has been brought up in a medical debate, which we shared with the participants before this panel as well. But the discussion of the fact that, you know, your identity is almost predetermined by medical practitioners or parents based on their assumptions or what they're going from a medical perspective in terms of quote unquote norms around what does a normal body look like. So I just want to keep continuing on that conversation, Gabriel, in terms of particularly your relationship to the word intersex. Do you identify with that word or with the community?
I do. So I guess identity is a difficult or interesting point for me. I currently, in terms of the identity I hold, I identify as an intersex man. I've had, which is not necessarily unusual, but not necessarily a common experience, where I hold dual identities, a transgender and an intersex person. So some intersex people are transgender, not all intersex people are transgender, and the vast majority are not transgender. That's just my personal experience. But I've sort of come into understanding of myself as an intersex person in adulthood when following up sort of on medical information and records, and it's not something that I grew up knowing about myself, and it's sort of only in the last few years that I've sort of come into that understanding of my body and my experiences in that way.
And Agli, can I just touch on your experience with identity as well, because we've talked about this in the past, but identifying as queer, not just from a perspective of being part of a queer community in the LGBTIQ context, but from an ethical and sort of a moral perspective.
Yeah, I think identity is a lifelong journey. You don't have a point at which you can say, this is how I know myself. The best word or the pronoun or the way to refer to myself is as Agli. And Agli as a name is the name I was given at birth. I was baptized, but it holds a story, yeah? It holds a story across culture, language, and lived experience. So working within the education space, I work with queer theory, queer feminist theory. And so I queer a lot of ways that we understand the world that we live in and the bodies that we live in. And so, you know, I do use the term queer in reference to myself, but may not always be the way that others understand queer, because I draw on queer feminist theory a lot. But in terms of that, for me, it's an ethical, philosophical concern, because, you know, I sit in tension with both male and female identities as an intersex, as a person with an intersex variation. I was born 46XY. The doctors said to my mum and dad, who did not have English as their first language, Agli is like a boy, but not a boy. So this was at the age of 17, when a lot of young people are figuring out their identity in relation to their family history and upbringing, but also they're moving into the broader community in terms of education, in terms of work, etc. And so, you know, for me at that point, to be given to hear that, and then to turn to my mum and dad and translate that into Greek, was like a very traumatic experience. And so it's been a long journey of then figuring out, well, what am I? Figuring out, I've worked predominantly in.
We lost you again there.
Belonging and becoming. I'm on the journey of being belonging and becoming, and I may not get there, but it's sort of it's part of an ongoing scholarship for me. Identity is part of an ongoing scholarship of an emerging story.
I think definitely that understanding that identity isn't something that you decide upon and then you are that for the rest of time, that it is an ongoing journey, an ongoing scholarship is absolutely something to take. Morgan?
Sorry. Yeah. I mean, identity is also thrust upon you, that you're some kind of visible difference, or even some difference that is not necessarily visible but is evident through medical testing, can create a framework where you are seen as being different, and where a difference is thrust upon you and some kind of other identity is thrust upon you. And I think that for me, the biggest discussion about identity is really challenging, because when intersex is framed within an LGBTI framework, that really privileges a kind of an identity framework that assumes that people have agency to express an identity. And it typically assumes that identity is either a sexual orientation, a sexuality, or a gender identity, a gender. And, you know, Gabriel, Agli, and myself, we don't share a sexual orientation. We don't share a gender or a gender identity, nor do we even share the same chromosomes or other characteristics. So one of the key questions for me as an advocate and as somebody that is engaged in community development is, well, how can we create space for all of us who have intersex variations and who are marked as other through medical discourse? And how can we hold space for all of us so that we can hold space for people with intersex variations who are heterosexual, people who are cisgender, people who are same-sex attracted, people who are trans as well. You know, that is really, making space for each other is one of the most important things that we can do and need to do as a community. Because, you know, all of us need access to peer support. All of us need access to each other. We need access to affirmative ways of understanding ourselves that can help us to flourish. So I think this is one of the questions that I've had about the Pride network at Sydney, but also other Pride networks that frame what it means to be LGBTI, or that sometimes inadvertently frame what it means to be LGBTI with a focus on sexual orientation or gender identity, without really paying attention to what it means to have an intersex body, a body that's different, and to have this identity expectations thrust upon you.
And I guess on that, Morgan, could I ask for the panel's thoughts on LGBTIQ, the acronym with I obviously being included, in what is, I think, predominantly and largely understood from a perspective in terms of what it looks like is what you've mentioned, Morgan: sexual orientation, gender identity, or gender expression. And I think that is the assumption of what that alphabet or that acronym stands for, rather than actually understanding the intricacies of difference within the intersex community around that sex characteristics. Can I ask for, open to the panelist floor, basically your comments or thoughts on, does I have a place within that acronym, and is it a feeling of acceptance?
It's a big one.
We like challenging questions.
Yeah. It's a real challenge because I think whilst the acronym allows for shared understanding of what it means to be stigmatized, what it means to be discriminated, what it means to be oppressed, in terms of how you choose to live a life, how you choose to be intimate with other. You know, there's so many tensions, restrictions placed on that. So if I draw on my own lived experience, where I experienced a lot of what it means to sit within the acronym, within the Tasmanian context, around the period of gay and lesbian rights, I didn't quite feel like I fitted into what my community, which I was in support of, were talking about. But at the same time, I could see the kinds of tensions that that community was experiencing around being male and female, being male and sexual, being female and sexual, what the society wanted you to be and not to be. And I suppose that sort of has shaped my storyline in terms of my own lived experience, in a sense. So I sit with tension in the acronym. I am married. You know, I'm married to someone who identifies as male. We joke that we both have male chromosomes or karyotypes. What does that mean? I don't know. I live within a body that was defined by hormone treatment. It was taken over by a medical profession, and they decided that, well, my variation is swine. And the history of treatment for swines is to make the body more female, mainly because that body has a uterus and a vagina. So therefore, we will define it as female. And because it also has the potential of becoming pregnant at some stage through IVF treatment. So when you're working with identity, you've got a lot of competing, you know, discursive spaces that you're working within. So I'm uncomfortable with the body that was created through hormones. It doesn't feel like my body, and it's never felt like my body. So what does that mean? I don't know. I'm figuring that out. People have chosen to look at me, especially when I'm not wearing makeup and have really short hair, and have asked, "Are you trans?" And I go, "Oh, well, what does that mean?" So you can see that for me, why, you know, sitting both within inside the acronym and inside and outside the acronym holds tension. And that's probably where I am right now, and as much as I can say at this point.
Thanks for sharing that, Agli. Gabriel or Morgan, did you have comments on that?
I feel like I land quite a similar place to Agli, actually, in terms of identity, and that I myself hold multiple points of queer identity, but I don't think that my intersex part of myself is part of that conversation. As such, like, there's a natural home, I guess, on the surface level to put intersex into the acronym, but there's other places where it sits quite comfortably as well, and is perhaps more useful to sit in those spaces, such as when we talk about disability and medical trauma, and those sort of communities. It's not this point of pride and identity in the way that it sits. I mentioned before, I have a quite complex sort of relationship to identity, because I mentioned before that I hold a transgender identity. I think that's just because language is imperfect for me, because I don't think that actually quite fits my experience. And for me, there is a bit of an interplay in the fact that I was assigned female at birth, I was put on feminizing hormones, and basically started my adult life in this very feminized body for years of female hormones and suppression of my male hormone profile. So I have a hormonal variation in that I had male hormone profile that was like typically male hormone profile around puberty, and having a body that didn't match that. The standard look at it was 2 seconds and bam, you're on estrogen and testosterone blockers and a whole bunch of things. And I really hated what that did to my body. And it really made me feel divorced from this reality that I was sort of existing in. For me as an adult, I made the decision to start taking testosterone to supplement my hormone levels back to what they were, and to feel in a body that I could live more comfortably in. So for me, in terms of that transgender identity, it's just because I accessed those healthcare pathways, and that was the way that I reclaimed myself, and I had a bit of control over the decisions that were made for me by my family, well-meaning. I also come from a Greek family background, and there's a big value in having children, and traditional gender roles and stereotypes, and I've never really kind of fit with that. And part of my identity was taking back the control over that for me. So I sit in the queer spaces as a queer person, as a, I guess bisexual would be a label, pansexual, just as a queer person. And that's what I bring to that space. I don't necessarily bring my body and intersex identity to the space so much as the fact that I pilot this body and I walk around in it. I've got brown hair, I bring my brown hair to the space. I've got an intersex body, I bring that to the space.
Morgan, your thoughts?
Yeah, this is challenging. I mean, when I didn't find out that I had what could be regarded as an intersex variation until years after I had hormonal and surgical treatment. And it's a long time ago now. So it feels like in some ways a very different situation. But I was on a journey where I found out that I had intersex variation, or found out I had a diagnosis or a series of diagnoses as an adult. And even as an adult, I trusted the doctors. I didn't have a language that could help me to navigate what I was going through in any way other than to understand my body as having a medical disorder or a medical condition. And the experiences that I had were really difficult. First thing that happened was I went on testosterone treatment. Then a year later, I had the first surgery, and I had 4 surgeries in 4 months. And those were not anticipated. The outcomes of the surgeries were not really clearly discussed with me beforehand. So I don't think I was able to really consent to what happened to me because it wasn't informed. And I ended up having, I guess you could say, a crisis about that. I ended up needing psychological support for a number of years to actually try and understand what had happened to me. And one of the things, back then there was no intersex community to speak of. It was years later when I began to find a community online. But even now, my fear is that if you watch the debate between myself and the two pediatric surgeons that is available to you, you can still hear the surgeons talk about educating parents and children to understand their bodies as having a pathology that can be fixed. So essentially, people are being trained and educated to understand themselves in the same ways that I was before I had access to peers and before I had access to any affirmative way of understanding my body. And the intersex movement for me is about helping people to find other ways of understanding themselves that can help them to make their own choices about their own bodies in their own time.
Is that, in essence, I guess, so you've talked about here, and I think all three of you have really touched on this importance of community, and that there is some tension, I think, in between existing within an LGBTIQ space and then also outside of that space as well. This importance of community seems to be something that I think is either was non-existent, a while ago, or maybe is, hard to find. When does someone find that, and how do you go about the process of, forming those connections, and what impacts, positive or negative, does the either lack thereof or the existence of a community have? I mean, that's a lot of questions and a lot of things to ponder, but does anybody want to tackle, what that sense of connecting to community does in terms of safety and understanding yourself and being comfortable in who you are and making those informed choices? Otherwise, I can pick on someone potentially to try.
I can go.
Yeah.
Morgan was probably the first person that I connected with later on my journey, which then started a critical process of understanding, what it actually means to be intersex. I think one of the things that I've learned is that for a lot of us in the early stages, it's a very, because of the invisibility, because of subjugating of knowledge, because of how information is given to us, how we are coerced into particular ways of being across, accessing treatment, finding safety, staying safe, within, family and the community that you're born into. So it's, communities is where you, for me, it's where I find a group, or where I found a group where I could actually, hang out in a way that I felt safe, in a way that I could then pull apart a very complex story, and to then start to understand all the different parts that have shaped the way that I see myself, the way that others see me, the way that I've been positioned, both, socially and professionally, and to try and develop my voice as the key point, to then do advocacy work, but also to develop a sense of agency so that I've been able to then push back to all of the, competing demands of me as a daughter, as a parent, as a partner, as an educator, as a professional, as a community member. You know, even my politics has changed as a result of being finding community, firstly through Morgan. I was aware of the, you know, what it was used to be called OII. You know, I read the stuff, but it was still from this fog, which was, you know, clearing slowly. And I call it a fog because one of the things that subjugated knowledge does is creates a fog that which you have to navigate through and to keep yourself safe through. You know, so it's yeah, community is about safety for me, and all the things that Morgan's talked about and Gabriel has talked about. It's that space where we start to, like the rest of the world, start to understand what has happened to us, and then how do we live with that in a positive and productive way.
Morgan, did you want to add to that?
Yeah, I mean, thank you. I mean, I think, Gabriel, I want to make sure you have space to speak, but I think I just want to add to that a little bit and say that these issues, the importance of access to peers and other people with similar lived experience is really what drives my work or demand that networks and places that talk about intersex people, that talk about LGBTI people, make space for us to understand ourselves as we are, but in affirmative ways, without having to understand ourselves as necessarily queer or trans, even if we don't have a queer or trans experience. I want to make space for heterosexual, cisgender, intersex people, as well as those of us that are not heterosexual and not cisgender. I want to make space for all of us to be able to understand ourselves and access the wonderful thing that is peer support and community. So that's really why I think it's so important to make sure that the ways people talk about intersex respects our diversity as a community and respects what it is that we share in common with each other as intersex people, and also what we share in common as LGBTI people, which is this idea that, you know, to be a real man or a real woman, you've got to have a body and an identity and a behavior that match certain gender stereotypes.
I'd like to just add a little bit as well. Great points from Agli and Morgan as well. And just to build on that, I think as someone who's relatively new in the past couple of years to finding intersex community, the value of peer support and that peer connection really can't be like overstated how important it is. And I'm finding every time I talk to an intersex person, the more I talk to intersex people, the more that we talk and share, we find these commonalities and these threads of experience that really helps break that kind of isolation, and new things come up, and I have memories come up and they're reframed in a completely different way where I haven't had to rationalize why I experienced something in a particular way or why I responded to it in a particular way. It's just understood. And to not have that before and to have that now is just an incredible sort of experience. It's added so much value to my life, and also just that openness and sharing with other people. For me, my understanding of myself for a long time was very pathological and medicalized. It was going to doctor's appointments and, oh, that's unusual, that's odd, I wonder why that's happening, this is abnormal, this is not good, we need to do something about this, this means that you'll have all these negative consequences, being told that it wasn't acceptable as you were and we need to do these things and to fix these things. And that's just how I understood myself growing up as a teenager, because I had a medical engagement, I think I began around 13. And that's really when you're forming a lot of identity and self and normalcy. And the social reinforcement for that as well, in that my parents sent me to a school that was all girls. There was a lot of social pressure to conform to that femininity that just wasn't inherently part of me and who I was, and also to make my body socially conform to that. And I'm talking like removal of hair and body hair from the age of 11 to look female, to blend in with my peers and to not have that social pressure. And just being told that my body was unacceptable the way it existed. And then to just be in a space where I can talk about experiences and things that I've had with other people and to have that just completely understood. If you haven't experienced it or you don't have any experience of it, it's really hard to put it into words. But I've met, and I know I was lucky to know lots of intersex people even before I understood myself as an intersex person. I mentioned Cody before, who's a great friend of mine, who brought me along to an intersex peer support retreat where I met Agli and Morgan and a bunch of other people. And I was in a room with 30 intersex people, and I just had to go away and have a little bit of a cry because I was just so overwhelmed, but in the best possible way. So connecting intersex people to peers is probably the best thing you can do for us.
Thanks, Gabriel. That's, I think, definitely highlights the importance of finding community and also just, creating that understanding and awareness of what it means to be intersex and the variations of experiences. We have had some questions come through. If you do have any questions, feel free to put them in the chat for everyone or direct message them through to me. But one of them is around language, which we have been really touching on quite significantly. Really, how and where do we start, just in terms of a broad overarching kind of comment. But if language existed, would it be easier for parents to start to understand options for their child? Does anybody want to tackle that around, I guess, origins of language in terms of, where it comes from that medical perspective? And does the language exist from a social contemporary understanding or perspective?
There's a couple of issues there for me. I'm jumping in a bit earlier. I'm sorry about that, Agli and Gabriel. But for me, the language that is used clinically offers an insight not only it offers an insight into how people are treated. So the clinical language of diagnosis and disorders of sex development is an indication that doctors think that intersex traits can and should be fixed. And it's that treatment, to me, that is the key thing that I want to change as an advocate. And the language, in a sense, is just a stepping stone on the way to making that happen. But there are some really significant difficulties in helping parents to access, affirmative peer support that can help their children to flourish, because they're not given a language that can help them to understand their kids in anything other than a pathological way. So as a group of people here, as a group of people who might perceive yourselves as allies or supporters of an LGBTI community, one of the best things you can do is if people talk about intersex variations, if people talk about disorders of sex development, if you can help steer parents or youth toward affirmative peer support, then that can help make a huge difference to them over time. I don't know that answers the question, but maybe...
No, I think it's good. It's a network, I think, that, creates and fosters that more inclusive support around how do you even start with language? Because I think it is something that, unless you have that lived experience or a connection to somebody who is intersex, then it is quite difficult to understand where to start. I might just continue to touch on language and, I guess, knowledge as a system. Agli, subjugated knowledge is something that we've mentioned and talked about. Can you tell us, I guess, about the dangers of subjugated knowledge and maybe your experience in discussing subjugated knowledge?
Sure. It's probably the topic that I've spent most of my working life doing, but one of the very simplest way of understanding the impact of subjugated knowledge is how it impacts on self and collective efficacy for me. And that's, beliefs about, what we can do, and how we can be as individuals. And, I've seen, working within the education space, I've seen how education across from early years, primary, secondary, university, and I've worked across all education sectors, and am now an independent academic for very specific reason because of the tensions that that sector has created. And so there are particular regimes of truth that we hold. And when we hold something to be true, we put a lot of effort and energy into upholding that and reifying it. And that makes it really difficult for marginalized groups to actually then find traction to liberate themselves from oppressive regimes of power. And so it's really, really important that, you know, and for me, one of the things that I've noticed being part of community is how lived experience is rendered as naive or, you know, unscientific or problematic or, you know, and really, I know myself better than my doctor knows me. Therefore, it's the responsibility of my doctor to actually stop. When I say stop, and to listen. And I think we're working within a university environment, or when working in a university environment where we've got a whole lot of disciplines that are shaping society, from the medical to the scientific, to education, to, you know, the education of nurses, of health professionals, etc. We need to really understand the dangers of subjugating knowledges. And I use knowledges because one of the knowledges that we subjugate is indigenous knowledge. And making room for that is really important because it's, you know, the diversity that we experience in bodies, it's not new. It's time old. It's
just losing you
for
there.
a very short time. But in that period of time, we have defined categories of being. Sorry?
We're just losing you there again a little bit, Agli.
Sorry. So the last thing I said is that what has happened through what we understand as scientific knowledge of categorization, we have created categories for being, belonging, and becoming. And then we put that into what we call curriculum, both, you know, different forms of curriculum. And then we move that through, you know, systems of power. And I think we really need to be critically aware of what this does and how it impacts on life, on lived experience, health, and well-being.
Yeah, thank you, Agli. Gabriel or Morgan, did you have anything to add to those comments or discussion around knowledge systems?
I'm someone that studies in the area of medical anthropology, so just wanted to really back what Agli's saying in terms of different systems of knowledge and value that we place. And the idea of sort of these like objective truths that we've ultimately constructed, but we don't acknowledge the act of construction around these. So really just wanted to echo what Agli has been saying. And I don't think I need to add anything to that though.
Thanks, Gabriel.
And I think just to go back in the point of the importance of community is the importance of giving strength to the voice of lived experience. And I think for me, the intersex community supports that. And that's where agency can speak back to the systems that subjugate us. Not just knowledges, but also subjugate bodies.
Yeah. I support what Agli and Gabriel have said, and I think that you said it really clearly and powerfully. And I think for me, as someone with a bioethics qualification and who's doing a PhD in bioethics, there are sort of philosophical approaches to the same issues that I find incredibly powerful. And in particular, I'm thinking of the work of Miranda Fricker on epistemic injustice and on the ways that knowledge is transmitted in ways that reinforce the power of particular social groups and forms of knowledge and disadvantage other forms of knowledge. So this, I think, comes through so strongly in medicine, where medical eminence and what is often perceived to be scientific objectivity is actually quite superficial. You scratch the surface, and what you see are gender stereotypes and social and cultural norms that really drive medical practice. At the same time, we see the ways in which scientific objectivity is used to construct a narrative about disorders that then disadvantages people who are trying to understand themselves. So this is very much, I think, what Miranda Fricker calls hermeneutical injustice, where people find it really difficult to understand their experience in ways that actually are meaningful. And it's, again, one of the things that I find concerning in LGBT spaces, where the narratives about who we are supposed to be are about sexuality or gender rather than the kinds of experiences that we may have had. That, again, we can find a hermeneutical injustice, a difficulty in actually finding, a difficulty in being understood ourselves and to others.
Also, just had sort of one last question that I think is probably all that we have time for before we wrap up today. But it's just around, I think, the inclusion of I within the LGBTIQ acronym. Is it interpreted as offensive to some people, some intersex people? If so, how do we mitigate that?
Are you happy for me to jump in here?
Yes, please.
I think really, if you're going to include the I, it needs to be intentional and it needs to actually mean what it says. Like, if you're going to put the I in there, you need to actually address intersex issues and intersex people and do that broad inclusion. We have this sort of idea in the LGBTQ space, particularly that there's no cis het people, so cisgender heterosexual people, and there's a bit of an attitude of they're in the out club and this is the in club. If you're going to include the I, that includes the cisgender and the heterosexual people that are part of that I. And it's just sort of, it seems to be a throwaway thing to chuck it in there for visibility or inclusion, but if you're not actually doing the work, if you're not actually addressing the issues, you're not actually advocating and elevating our voices, then it's very tokenistic and superficial to chuck it in there just to tick a box. But
the other view of this, which is equally, I think, significant, I agree with you, Gabriel. There's so much that inclusion has to be meaningful, but then exclusion is also consequential, you know. And if intersex is excluded, then where and how do we talk about the issues that we care about? So, wherever we fit, that there needs to be space for people with intersex variations to talk about ourselves in ways that are meaningful and to develop community. And there are strong relationships between what it means to be intersex and what it means to be LGBT. We were medicalized together. We were medicalized together on the basis that we don't fit this normative idea about what it means to be a real man or real woman. Some of us are still profoundly medicalized and othered. So I think for me, it's about understanding that basis for the relationship between our populations and making space for each other to talk about the issues that we care about.
Agli, any closing remarks?
As I said earlier, it's you know, for me, it's a space of tension, both from my lived experience, but also in terms of how I've seen LGBTQIA being engaged with in education spaces that is often very exclusionary and very you know, normative in a sense. And I think, you know, there are dangers, but also I think why it's important and why I think it still needs to stay there is, and we hope that the LGBT QA plus community can help us and assist us as allies to become visible and to raise awareness of issues that are important for all of us, whether we are intersex or endosex. You know, and I use the two terms that sort of are starting to be used to talk about the different populations. So I think for me, it's important that in terms of creating spaces that are safe for people to then figure key issues and tensions. And so, yeah, it's really hard because I agree with what Morgan has said and with what Gabby said. So I'll just leave it there, as well as, you know, adding what I've said. Thank you.
Well, we're pretty much at the end of the session today. I think, again, we have really only just scratched the surface, but hopefully on some really important topics that maybe have brought to light some issues that you may not have thought about before in terms of impacting people with intersex variations, understanding the importance of language, the connection to community, and always questioning our understandings of what is normative and where do our understandings even come from in the first instance, particularly when we're looking at things from a pathological perspective or medical interventions, and how those impact on our family really within the intersex community, and doing things with intention when we're including I in the LGBTIQ acronym. So I really want to thank Morgan Carpenter, Gabriel, Filpi, Agli, Zavros-Orr for their time and efforts today. It doesn't go unnoticed, and it is something that I think is incredibly important in sharing stories and just really making yourselves visible, which is really what I think Intersex Awareness Day is about. Of course on Monday, but we're celebrating it today. I think can still be celebrated at any time. But again, thank you so much for joining us today. And Morgan, Gabriel and Agli, thank you so much for your time. It's really appreciated. For anybody who has attended today and anyone who was unable to attend, obviously we'll share this recording and we'll share those links to some of the resources which we discussed. And I would really encourage you to engage with Intersex Human Rights Australia. There's a wealth of resources, videos, testimonials, readings that you can do. And I think that's one of the best things that you can do in terms of understanding how you can support our intersex family is by reading, educating yourself, looking out for advocates, following authors, looking into research articles, particularly when looking at it from a university perspective, but just engaging with and sharing stories is a really great place to start. So I think we'll leave it there. But yeah, lots of thank yous coming through on the comments. And again, thank you, Morgan, Gabriel and Agli.